Hi, my name is Faith. I'm an ITU nurse. I work in cardiology. I've been a nurse for 2 years now. I previously used to work on the ward in cardiology as well. So I'm going to speak about my experiences in COVID and being quite a new nurse. So in my experiences with this pandemic and COVID, I realised that in terms of patients, especially with there being restrictions in allowing visitors to come into the hospital, I realised that our patients needed a lot more comfort and us to be more there for them instead of their family, as their family wasn't there for them and they couldn't have anyone there to be there physically for them. So we basically had to then become their family to help them through hard times, especially in this uncertainty. And obviously they had a lot of fears in this whole pandemic because obviously COVID was a new virus that had sprung out, and to their knowledge they didn't have any knowledge in terms of it. They was just suffering from it. So we obviously always had to give them more knowledge in terms of the COVID, in terms of their symptoms, how to deal with it, also how to deal with their own emotions, ensuring that we're always helping them. So, and also in terms of my experience in ITU, as I'm quite a new nurse in ITU, in terms of my experience, as I've only been working there for 4 months, I realised how it's completely different from being on the ward. It's more intense obviously in terms of the word. So you have to have more knowledge in terms of what you're doing and how you're practicing nursing. Also how you work with your patient, because some of them are unconscious and some of them are conscious, and how you have to deal with the patient and ensuring that they are always in comfort and looking at their signs of, especially their body signs of how well they're taken to the treatment. Also, you have more numbers to look at in terms of being on the ward and being in intensive care and having to interpret those numbers to ensure that your patient is being treated well. I do like the team on intensive care. You do work very closely with your team members, and you are directly giving your patient one-to-one care continuously throughout your whole 12.5-hour shift, which is very nice compared to being on the ward. You're able to meet all of their needs instead of on the ward. Not all the time you can meet all their needs. So that's one good thing about being in intensive care, and I like the part of being able to always help my patient to my best of my capabilities. As a student, my last placement, my management placement, it was on ITU, and from there my interest was had increased to wanting to actually go into ITU after my experience of being a newly qualified nurse, because it's quite hard to get into ITU straight away. So after I got my experience as a newly qualified nurse, after 1 year, I applied for ITU, so I applied and then I got the job. And I've always wanted to go in there because obviously there's a big difference of care that you're able to give to your patients, because obviously in intensive care it's one-to-one, and being on the ward you get very busy, especially if one patient gets very sick, then you have to obviously prioritize that patient instead of the rest. So in intensive care you can always prioritize your one patient, and so my attraction's always been there. And then obviously I want to grow more into the critical care aspect of nursing. I didn't really come in, I came in the middle of the pandemic into ITU, so it was quite a bit weird, because obviously the structure of obviously being a new starter into ITU was a bit different. So it's completely different from being on the ward in terms of COVID and being on one of the COVID wards. You'll be completely geared up with your PPE, so the symptoms was quite different, because whereas on the ward you'll see more people like coughing more, whereas when they're being extubated, it's more, they're intubated, they're obviously, it's showing more within the ventilator, them being ventilated, and the death rate obviously there is more higher, and you're seeing more patients die, which is obviously more sad, which you have to come to terms with, how many people were dying on ICU. It's drastically reduced now. Because my ICU is cardiology, surgical. They have minimal amounts of surgeries that they have per day. It's not that busy. Some days there could be half the amount of patients compared to how it would normally be. And there's quite a few nurses, you can say, that are able to help with that one patient, and the teamwork is very, very well on the ITU. It's completely different from prior to COVID, as it will be more busy, but afterwards, and especially with the vaccinations, it's decreased the amount of COVID patients that we have, and we don't have any positive COVID patients on our ITU at the moment. I would say it's very important for us to follow the hand washing regime, ensuring that our hands are always clean and that we're wearing our PPE correctly, so that we can protect ourselves and protect our patient as well, because obviously we're coming from the outside and coming in, especially as well as the patients as well coming inside and coming in. You don't know what you're crossing with, and obviously we have to then swab the patients and then obviously wait for the results. So it's always important that we're always keeping one another safe, and as well as our colleagues, because if we're making one another sick, then we can't actually care for the patients, our nation. So we need to always make sure that we're always geared up and always following the right protocols. Nursing is very different. It's not completely what I had expected. It's a very rewarding job. You're always able to help somebody in many ways, more than just their illness, but also them personally. So really and truly, just always go the extra mile to make a difference every single day, and you can always make an impact on someone's life every single day. So that's a good thing about nursing.
Thank you so much.
Thank you.